Good afternoon. Here today on the traditional territory of Treaty 6, and I recognize the Métis people of Alberta who share a deep connection with this land. I can't see this announcement today being anything but an incredible disappointment to Alberta's paramedics and other frontline healthcare workers. In the past 6 months, the UCP government and Danielle Smith have created further chaos throughout our healthcare system by firing the CEO of AHS, Dr. Verna Yu, the Chief Medical Officer of Health, all 12 of their appointees to the AHS board, and driving both Deputy Chief Medical Officers of Health to tender their resignations. Danielle Smith has claimed that was essential to act decisively and quickly to address the ongoing crisis in our healthcare system. But after 34 days of her direct control through her appointee, Dr. John Cowell, this is all she has to offer. The announcement of an idea that's been under discussion and indeed use in the community for months. This response from the UCP, there is nothing new here. There was nothing that required the Premier, the Minister of Health, and their top appointee to AHS. There's nothing new here. The UCP's response to the EMS crisis is grossly inadequate, and it does not address the significant staffing shortage throughout Alberta's healthcare system, including paramedics and emergency room staff. I think it was telling that today there was not a single paramedic, nurse, or any hospital staff that stood with the Premier, the Minister, and the top administrator for AHS for this announcement. The UCP's persistently combative relationship with healthcare workers since forming government has thrown this system into chaos. It has done significant harm. It continues to do significant harm. Now, to be clear, I hope this announcement today does make some impact. And you know what? I believe on some level, for a certain amount, it will. But the bottom line is ultimately we do not have enough paramedics. To recruit and retain more paramedics, we need to treat the ones we have better. Paramedics have 3 specific calls. This is what we continue to hear from them and their elected representatives, which again the UCP utterly ignored today. First, that we ensure all paramedics can get off shift on time. Secondly, that all part-time and casual paramedics be offered the opportunity to take a full-time position where they will have full support and benefits. Third, the UCP has to do far more to offer harm reduction services and reduce the number of overdose calls for ambulances. There was no action on those calls today. Calls that have been around for months, much like this announcement that they brought forward today, this idea they are putting forward. I'm also concerned that this move towards non-medical vehicles for interfacility transfers is simply a step towards further privatization or more privatization of ambulance services. Indeed, I would note that the single idea they put forward so far in this situation to address pressures in EMS is one that will require many Albertans to pay out of pocket. Fundamentally, the problems in our ambulance system are part of a larger crisis that the UCP have created and continue to stoke in our healthcare system. Just yesterday, the Stollery Children's Hospital declared a state of emergency. They are now requiring already exhausted staff to work more shifts and cancel Christmas vacations. The Alberta Children's Hospital in Calgary has built a trailer to extend the size of the waiting room, and a children's hospice is having to redeploy their staff to try to shore up staff at the hospital. You know, I asked the Premier multiple times in the legislature over the past few weeks to simply promote the COVID-19 and influenza vaccines to help address the spread of respiratory illness. She refused to answer each time. Instead, what do we see in the last week is Danielle Smith attempted to quietly appoint a role for a parliamentary secretary to support the unvaccinated. Alberta's healthcare system is in crisis. It needs real leadership, and it's clear that is not going to come from Danielle Smith and the UCP. But an Alberta NDP government will bring real resources to the front line. We will work collaboratively with healthcare professionals. We will follow the science and empower medical experts to help protect the health of Albertans, and we will end the chaos in our hospitals. Thank you, and I'm happy to take questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start with any questions in the room. Seeing none, we'll move to the line. Just one question and a follow-up. Caller, your line is open. Sorry, Lisa, is that you? Your line is open.
My question is about a mask mandate. Yesterday, the UNA asked for a province-wide mask mandate. Today, the Premier said that she supports choice. Sounds like she's not going to do that. So just wondering what you guys think.
So what we have repeatedly called for throughout the pandemic is that these are decisions that should be made by public health experts and not by politicians. And indeed, part of the issues that we had throughout the COVID-19 pandemic was the continual political interference and politicization of many public health decisions under the UCP government. And certainly we are seeing that continue under Premier Smith. So what we believe is what we have called for all along. We've called for an independent science table of medical experts to be able to provide that advice clearly to the government and to Albertans. We support an independent chief medical officer of health who is supported to make decisions on important matters like this for Albertans. Instead, what we see is a government that is putting its thumb on the scale, making political decisions and choosing to ignore science in favor of its own ideology. So really what I would like to see is clear statements coming forward from the Chief Medical Officer of Health and Albertans to have advice from medical experts in making these decisions.
Do you have a follow-up question?
So I'm assuming that you do speak to health experts as part of your role as critic. What are they telling you, and are they telling you that we do need a mask mandate, and would an NDP government do that?
So we have heard clearly from frontline health folks. The section of pediatricians with the Alberta Medical Association has called for masking. Certainly emergency physicians, a section of emergency medicine with the AMA has also made that call. We have heard from UNA making that call. So again, an Alberta NDP government, we would follow the advice of public health experts. We would work with the Chief Medical Officer of Health, support and empower the Chief Medical Officer of Health to communicate clearly with Albertans and to make those decisions.
Thank you. Just a reminder to state your name and outlet. Next caller, your line is open.
Hi, David. It's Lisa Johnson from the Edmonton Journal. I have an off-topic question, just hoping to get your reaction to an update we got from the Health Ministry yesterday regarding insulin pumps. Okay. We're being told that those who are eligible can start accessing them as early as Friday, depending on the supply. And for a lot of them, new pumps should be generally available within a few weeks for clients who meet the program criteria. So I'm just wondering for you, what do you think about that update? Does it meet what you were calling for yesterday?
So I'm certainly pleased to have that update because we largely had radio silence from the health minister towards type 1 diabetics in the province of Alberta for about 6 months. So there certainly has been a lot of concern and anxiety in the community. What this suggests to me is that the government is scrambling. This is a last-minute announcement that wasn't made officially. It was made in response to pressure from outside being announced just before Christmas, and putting Albertans in a position where they will have to scramble now if they want to take advantage of that opportunity. So ultimately, is this good news? Yes, this is what Albertans with type 1 diabetes have been asking for. But once again, we have a government that is acting last, acting least, coming from behind the 8 ball. And unfortunately, it clearly has not been prioritizing the needs of Albertans because they've been too wrapped up in their own political drama and infighting.
Do you have a follow-up, Lisa?
No, that's good. Thank you.
Okay, we'll just do one more pass for questions then. Anything in the room? Nope, seeing none. We'll do raise hand if you're on Zoom, *9 if you're on the phone. Okay, caller, just state your name and outlet, and your line is open.
Hi, it's Colette from the Canadian Press. David, you talked about this potentially further privatizing health service. Is what they're doing with changing the ambulance services moving toward a more user-pays system? Like, is that one of the things you're worried about, or can you explain that comment?
Sure. There's a couple pieces here. First of all, they are reaching, from what I understood from the press conference, what they heard them saying is they're actively reaching out now to private contractors to take on this piece of the work. So they're looking for further privatization of healthcare services, but basically more public dollars going to private providers to provide services within the system. Secondly, I was noting that, under a premier who has openly mused for the last year and a half about trying to find more ways that Albertans could pay out of pocket, in fact, ways to introduce things like health savings accounts to get them used to that fact. That one of the sole steps we see this government taking forward, or at least one of the first it's bringing forward on the EMS issue, is one that's based on Albertans paying out of pocket. It's a disturbing trend with this government, and certainly one I think we need to watch closely.
Colette, do you have a follow-up?
Yeah, I guess I'm just trying to get some clarity in terms of, so do Albertans not pay for that ambulance service right now? And would that change under this, from your understanding?
So I think, as the minister noted, Albertans do pay out of pocket for ambulance services when it is a non-medical service. So I recognize that is currently the case. Certainly, again, that's the direction this government seems to go, or that's the first thing it puts on the table when it's talking about addressing things within EMS. So simply noting that was the case.
Okay, thank you.
Thank you. We'll just do one more pass for questions. Raise hand function if you're on Zoom, *9 if you're on the phone. Seeing none, that concludes today's press conference. Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.